as pain management is a grosser subject, I would like to be more precise on the topic which I'm going to share. So I have tailor-made the presentation to fit into the 20 minutes slot. So I renamed the presentation like Clinical Approach to Chronic Patients with Pain Dominant Disorders. I'm presently working as a principal and I'm a professor and HOD of Department of Kaya Chikitsa of Dr. B.R. K.R. Government Ayurveda College, Hyderabad, which is almost an 80-plus-year-old institution. Yeah, pain is an unpleasant sensation localized to a part of the body or the total body. So the chronicity should be understood here. A disease that persists for longer time. As per US National Center for Health Statistics says, the chronic disease is one lasting for more than 3 months or more. So there is no specific time durations here. I'll just come to the more precise details in my coming part of presentation. Chronic diseases are defined by WHO are like this. Chronic diseases are diseases of long duration and generally with slow progression. On a grosser area of compiling all these definitions, we can understand that chronic diseases generally cannot be prevented by vaccines, are totally cured by medication, nor do they just disappear. So how we should try to understand the chronicity from Ayurveda? If you see the Sadhya Sadhyata, the prognostic scoring, it is grossly into Sadhya, Asadhya, you know about this. And the Yapya, the feature mentioned under, the features mentioned under Yapya will more or less absolutely fit into the chronicity and give more enlightenment to the chronicity. So coming to the pain. So how pain is expressed in Ayurveda? It is a huge topic, as my friend who dealt in detail and made my way little easy about Vata Vyadhis. So the pain is very predominant and pain is described with different terminologies. So I have made the screen into two halves. The left half like Vedana, Toda, Shula, Ruk and Beda are severe pains, whereas mild pains I have classified Chinchima, Pipilika, Riva, Angapida, Angagaura and Angastamba. So the spasmodic lesions and other things can be classified here, and the pains, colic pains, they'll be coming like Shulavat, and different expressions of the pain made by patients were handled by Ayurveda as a textual references, and we see them that their time-tested validity even today in the OPDs. When patient comes, they describe the similar type of pain in the local language. So pain dominant diseases, I'll be just touching few of the important aspects to deal the pain dominant factors, how we are handling them in our OPDs and IPDs. So these are the few diseases like Vatarakta, Amavata, Udarashula and Sirashula, Ashmari, Arshas, Manyastamba and Katishula. So these are the, I'm not telling only these four. I'm just taking few examples to draw your attention that we can deal the pain topic under such headings. So we need to understand pain pathway from Ayurveda. For that, the marma will become as one of the very instrumental tool in understanding pain pathway from Ayurvedic perspective, like Sadhya Pranahara, Kalantara, Vaikalyakara, Vishalyagna and Rujakara. Ruja is a pain and Rujakara will give us a pain pathway, and its understanding, it adds knowledge for us to handle it in a better way. Likewise, if you just see the functions of the skin, I just want to say that the pain is not simply perceived as a pain. It has multi-dimensions in understanding that. Then only we can go for Amsamsa Kalpana of the Chikitsa, what I mean to say. So I'll be driving through my presentation to this perspective. Pain will be grossly classified like pain threshold and pain at the local area, and how the pain travels and how pain perceived by the brain, and how brain or human body responds to the pain perception. Basing on this only, we can handle the pain in an effective way. This is my understanding. So if you just see skin as a skin, so it helps from vitamin D synthesis, and it will be it becomes as a indicator even to understand the PSA like things, and it produces cytokines, growth factors, multiple functions as I'm showing here. So I'd like to draw your attention to the slide for a few seconds. Like this is a normal anatomy and physiology of the nervous system, like sensation and perception and behavior and motor. Motor activities are from anterior end, and sensation and perceptions are from posterior ends. So I would like to draw your attention. These are the pain sensations if you want to handle, like Shirodhara, Shiropitsu. You can locate the posterior part of the cerebellum where it will be more effective. And we are doing some sort of activity and trying to document the results. So whatever is the pain, like visceral pain or something. So the sensation, pain sensation or pleasure sensation, when it is received, it may not be perceived properly. So how it is perceived and how it is being expressed, there is a gap again in this. So for better understanding of this type of complex mechanism, Ayurveda added a component like sattva, so which speaks about the simple component. I'll be talking about neurotransmission and neurotransmitters. I would like to draw your attention only on this calcium gated channels, how they are responsible for pain management. I'll tell you, I'll link up with another slide where we are handling the spinal pains by using this particular thing, and even certain joint pains also we are handling by utilizing the ionic calcium into parenteral roots. So this is what I'm telling, like sattva and experiencing the pain. For every individual, pain differs by experience and expression, but the quantum of pain there is same. So this is a scale what we have brought into the what is been depicted in Ayurveda, like pain experience for same X quantum of pain. If it is severe, we call the person as Avarasattva. If it is moderate, then Madhyama Sattva. If the response is very mild, then we call him as Pravara Sattva. So this shows us a pathway that if you can handle the Sattva in a better way, which is responsible for pain thresholds and other things, then it paves the way for easy handling of pains. I don't say that easy in the sense, literally like just like giving a pain reliever and you can make disappearance of the pain. But definitely pain can be better handled if you adapt all these clinical practices. So if you see dosha and speed of pain impulse, I would like to draw your attention here for the speed of the pain impulse. So if it is very acute and very speed, then patient will be agonizing and excruciating pains will be there. And if pathway is slowed down, then patient threshold and pain pathway can be handled, and patient can tolerate the pain in a better way. And so for that, we are just denoting here a principle. Like vata will be a quick channel of impulse, pitta will be moderate, kapha will be slow. When you compare vata rajo quick, vata tamo slow, and vata pitta moderate, vata kapha slow, and vata sattva, which can ultimately contribute to the pain threshold. So likewise, Vikalpa Samprapti, you know very well about Vikalpa Samprapti and its relation with pain in relation with vata. I'm showing here in this slide using the central modern, pain pathways described in the modern literature. Like Ruksha and Kara, they have the similar pain pathways, like nociceptor induced pain pathway or neuropathic pathways, whereas Laghu is like ascending pathway, because Laghu is a lighter aspect which can always be compared with ascending pathway. Sita makes the pain mechanism more complex, so it comes under central mechanism. So whereas Sukshma and Laghu, if they are together, the ascending pathway is more, and pain impulse will be traveling towards the posterior brain in a very quicker way. Chela, it also contributes for neuropathic pathway and pain transmission and modulatory pathways. So this is a small workout I have made in bringing the pain dynamics to be understood by a simple algorithms. So this is another part I would like to say. This may not be a final one. I told you this is a tailor-made presentation to fit into this 20 minutes. Of course, it has fractions in that and it has exceptions also. But in general, so So if you see pranavata and pranavata involved conditions, prana, vrita prana, or prana plus prana multiple times involved, then nasya, vasti, and vatanulomana. Vatanulomana is expressed here as VA in coming slides. So prana and udana, vamana and vatanulomana, prana and samana, pachana, vamana, and vatanulomana. So prana, apana, when they are involved, virechana, vasti, and vatanulomana. Being vatanulomana will be a common manifestation for all of the variants of vata. Prana, vyana can be handled better by vasti and vatanulomana. Likewise, I would like to draw your attention for pain and sleep relation, because this is directly related. So I would like to show you some statistical data which which is made into a palatable form on the screen. National Sleep Foundation from CDC has given what is the sleep hours required for different aged people. This is a just display. My attention in bringing this slide is Ayurveda speaks about sleep and its relation with the pain. And by correcting the sleep, you can attend the pain management also. Nidrayattam sukham dukkham pustika shabalabalam vrishita klibata agnanam jivitam nacha, like that. Sukha dukkha, it's a comfort and discomfort, and bala abala, like that. Pusti and kasha about pain threshold. So gnana agnana is perception. So vrishita and klibata, how you respond to that. So like that, we can bring out algorithms by using this particular reference. For that, we require to pay more attention towards pain threshold. Usually, we don't adapt this particular procedure in pain management unless they are admitted and we are going for a complete management of the pain. But in OPD levels also, we could able to handle pain with this type of tools like Abhyanga, Seka, Pichu, and Vasti. Seka and Vasti, they may require some time in the hospital for undergoing for the process. So we use Pichu and Abhyangas very effectively, and Pichu has wonderful role in improving and modulating the pain threshold as desired. So coming to the, I just show one reference from one neurological journal called Brain and Neurological Diseases and Pain. This is an article published in 2012, how this makes the algorithms of the brain, they have described into a small pictogram. So this will be very easy for us to understand. So if you see that this is a normal brain, the PNS, paranasal sinuses and CNS damages. So if you can see peripheral nervous system and CNS damages, sorry. So you have blocks and other things, more complex mechanism. If you see the chronic pain brain, so this will have a different algorithm here where you need to consider these three areas. Like this is a chronic pain brain. The previous slide I'm expanding here, like altered function, altered structure, and altered chemistry. So as my previous speaker, Dr. Prasad, very strategically narrated one point that pain cannot be managed by a simple one drug management. Basing on the condition and the structures involved and the pathways, you can pick up the drugs or you can modify the drugs and you can make a new algorithm or a program for handling such sort of pains to bring in that sort of this. See here regions affected, this is examples and mechanistic process, how it is involved, because I'm not going in detail to this. This is very easily accessible article. So coming to the pain and its temperature relations with temperature and body pain. So if it is because of pitta, the cold paddings and sita saparyas, like they'll be more helpful. Like Chandanabala Lakshadi will be helpful in pitta dominant conditions, whereas in Ushna you can think about Balashwagandha, Mahamasha. When purely Vata is there, Vata Kapha is there, you can think about other combinations. My intention is to say that this is also an important factor, and this can be applied as convenient and as more effective in each case. So if you see chronic pain management, I would like to vote for these three modalities like Daiva Vipasraya, Sattva Vijaya, and Yukti Vipasraya. So Daiva Vipasraya, what it makes is it diverts your attention to the chronic pain to other area. So for that, you should make his mind more vulnerable for your treatment modalities, which can be obtained by Sattva Vijaya, and you can handle the pain by properly adapting the Ahara and Aushadha by using your Yukti Vipasraya. I'll be dealing them in coming slides. So you know what are the 6 important modules we have like Shadupakramas, Langana, Brahmana, Rukshana, Snehana, Svedana, and Stambana. Where to use, where not to use. This is very important. If you see the Chikitsa and its grosser classification, Swastha and Atura is the basic classification. If you go into Atura, Daiva Vipasraya, Yukti Vipasraya, Sattva Vijaya, and Yukti Vipasraya is again three types: Anta Parimarjana, Bahi Parimarjana, and Sestra Pranidhana. I would like to draw your focus on to this particular point. We give more importance to Anta Parimarjana, neglecting Bahi Parimarjana Chikitsas. But if one can blend the treatment by properly blending the ratios of Anta Parimarjana and Bahi Parimarjana, definitely this is adding comfort and better feeling of wellness, more feeling of wellness and better status to the patient. So if you want to go for Shodhana Karmas, you know Purva Karma, Pradhana Karma and Paschat Karma, you know about all the classifications. My intention is when you go for Paschat Karma, think about Rasayana there when you are adapting a pain management, pain dominant disease, and then adapting for a Shodhana procedure. Adapt a proper Rasayana where the relapse of pain can be handled and pain threshold and pain pathways can be handled very effectively by adapting to a proper Rasayana therapy. And coming to the, see, this is another simple and algorithm I would like to propose. Like vasculature is more involved. Then Pushkara Mula, Haritaki, Chitraka and Trikatu will be used. I'm not dictating that you should use only this, but we are finding better clinical efficacies with these combinations. And Mamsa Sosha, Ashwagandha and Kapikatsu Masha, when pain is only the involvement and you just want to go by a blind shot, then Erendamula, Rasna, Nilgundi, Chokchini, Sunti, and numbness is more, Dashamula, Devadaru, Chokchini will be helpful. Stiffness is more, Erenda Thaila, Musta, Haritaki, and Vacha will be the drugs of option. I'll be sharing hereafter the clinical formulations which we are using in our daily OPDs from our student days to current days. So which are proved to be very, very effective in clinical usages. And this is not a staunch claim. This is only a realistic sharing of experience. So we see Kostrika Sirshaka Vata, where they draw the fluid from the joint and they use high antibiotics. There will be a lot of recurrences and a lot of issues in handling such uni-joint pains where there is an infection. So we used to handle this type of infections from our student days like Chokchini and Samirapanaga combination. But due to certain constraints, we have improved by adding Pravala into that. And Chokchini 60 grams, Samirapanaga 10 grams and Pravala Pisti 10 grams made divided into 60 doses. If patient is not seeing the patient conditions, Anupana can be prescribed. And with this combination, without using any other drug, you can see the grosser improvement of pain and swelling and infection comes to the control. We have published an article in other journal. I could not able to add here the article. I'll be sharing it later through other modes. So another area which we practice in because we are working in a government hospital where the very poor patients, there will be more coming to the hospital. So where it will be very easy with a single dose of remedy. Like Lasuna Kshirapaka, we have made it more simple to use at their homes. And we are handling Katigrahas, Namanya Stambhas, Janusandhis, and many painful conditions by simple adapting the Lasuna Kshirapaka. Lasuna, we basing on the patient's Prakriti, Deha, Kala, Rutu, etc. We prescribe the ratios of Lasuna, water, and Kshira, air and Thaila. So basing on the type of costa, we prescribe the air and Thaila dose. And this is a single dose, but we can definitely depend on this formulation also. And this is one of the important work we have carried out on a huge number of patients, and one dissertation work is also been done on this particular formulation, like especially IVDP's pain related to IVDPs, excluding all other complications which are not handled comfortably in the OPDs. So we are taking Balashwagandha or Mahamasha and other combinations of oil, 60 ml, and 1 gram of Pravala Pisti we add to that, made emulsification, and we use it like Matravasti. Whether there is a question again whether we can name it as Matravasti when you are adding Pravala. So I don't want to go into the theoretical conflicts. We consulted an expert from Rasasastra, Dr. Gopi Krishna from Ballari, and we took his technical support. And then we started handling pain, especially excruciating pains like radiculopathies. Also, we could able to handle up to certain extent by this modality, and it's cost effective. It slashed the pain management hundreds of times and brought it to the palatability of even a common personality. So if you think about acidotic and alkalosis like conditions involved and pain is perceived in cancers or renal failures like that areas, you can think about Gomutra as a remedy. And if there is a stamba for the local area and samba or sosha, then local abhyanga can be done with balashwagandha and adding egg white to that, make a emulsification, adding saindava lavana, little saindava lavana, and do abhyanga, and with this particular combination, it will be more clinically useful. And we started using Vardhamana Pippali yogas. It is not a classical Vardhamana Pippali yogas. Vardhamana yogas they have mentioned. We have tailored it to the need of OPD requirements in our hospital. So when there is a colicky pain, we use Vardhamana Pippali, or when once pain comes to the palatable area and we want to retain that particular healthy status for more time, Dr. Sailendranath Saxena, who is a professor of Rasastra department of our college, has contributed as a reference from Vangabasma that it has an indication like Sumati Pradam, where we can think about apoptosis, restoration of cell biology, and serotonin and dopamine regulations. Considering this, we have not used this particular drug on a huge cases, but we have used on certain cases where their pain threshold levels and their positivity towards pain can be well created and well maintained. You know about Ballataka Dashakas, I'm not reading them. So Amruta Ballataki Lehyam from a standard company we take and we convert that into Vardhamana Yoga. As I have shown here, we just make some pills-like structures and we ask them to consume. So once we show them in the hospital, then they can continue at the home. And closely, our postgraduate scholars will be monitoring all these areas. And coming to the Ahara and its relation with the pain modulation. So Smriti, Medha, Buddhi Balakari are attributed to Grita. So where the Pitta dominant and Vata Pitta dominance is there, Gritas can be used. And where Pitta is exclusively dominant and bleeding disorders are also involved, Rakta is involved, Santanika and Navanita will be preferred. And exclusive pain, you can think about Thaila for having pain control, better pain controls. Coming to the last slide, you know, Gugulu will be a Ramabana for pain management. Here are few indications for each type of Gugulu. Amrata Gugulu for Pidaka, Staulia, Bagandhara, Gugulu Rasayanam for Medoroga, Navaka Gugulu for Kapha, Amavata, Punanava Gugulu for Sotha, Gugulu Panchatikta Guta. You can remember here Hastapada Svedadikyata. You see, people come to the hospital and complain about perspirations in palmar surfaces and plantar surfaces. So in such conditions, Gugulu Panchatikta Guta has a specific indication. Loha Gugulu, of course, Gulma, Costa. I mean, you can think about colicky pains. Shadushana Gugulu in Medha Uruddhi, where different clinical manifestation. Simanada Gugulu in Ama and other conditions. So coming to end of my presentation, I would like to acknowledge the whole team of GAF 2021 for their tremendous and awesome effort in bringing together the experts of Ayurveda and entrepreneurs of Ayurveda onto one platform to share their experiences. And to make this possible, I especially congratulate Dr. Gigi Gangadharanji, who is an instrumental personality in making GAF progressing towards forward. Dr. Jayan, Dr. Jitesh, Dr. Arjun, all his team require a better applause. And Dr. Srinivasa Prasad for sharing his topic for me to share my ideas on that particular topic with all of you. And each one of you for your patient hearing. I acknowledge and I thank each one of you. Thank you so much for providing me the opportunity.